Canadians who use medicinal marijuana may be forced to pay more for the drug. The federal government is proposing changes to the way patients get access to legal marijuana. Ottawa says it wants to make the process more streamlined, but the drug's cost is expected to rise significantly. The CBC's Megan Fitzpatrick is in Ottawa now, and she joins us with more on this. So, Megan, what sort of changes does Health Canada want to make?
They've already published these proposed regulations online, and later today Health Minister Leona Agluka is holding an event in British Columbia where she's going to outline them. Basically what the government is doing is taking itself out of the business of supplying medical marijuana, and it's going to create a commercial market for it. So right now people who are approved to use it can buy medicinal marijuana through the government, through Health Canada, which has a contract with a private supplier, or they can grow it on their own or designate someone to do it for them. What the government is going to be doing is instead giving licenses to companies to do this. It's going to open up the market, and people will no longer be able to grow it for themselves or have someone do it for them. Another major change that they're making under these proposed regulations is how they approve who can use it. So right now, again, Health Canada takes care of all of that. People have to apply for a license and permit to be able to use marijuana legally for medical purposes. Health Canada is going to transfer that responsibility into the hands of doctors and other healthcare practitioners. They're the ones that are going to have to sign off on it. That's another major change. Also, there's a possibility that pharmacies might be able to dispense it. That's something that's going to have to be worked out with the provinces and territories. But really, this represents a complete overhaul of the program that's been around for a few years now. Health Canada says it wants to get back to more of its traditional role as a regulator as opposed to being a producer and supplier of medicinal marijuana.
It seems some of these changes are being made for safety reasons. Explain that to us.
Yes, that is one of the reasons they've mentioned why they're making these changes. They say they're addressing safety and public health concerns. There's been a lot of complaints from police organizations, fire organizations about the risks of people growing marijuana for medical purposes in their own homes. Things like electrical hazards, the fire risk. Also from a safety point of view, the risk of their homes being broken into and theft of this marijuana. But that's not the only reason they're making these changes. Another reason is the cost of this program. Health Canada spends about $20 million a year on this program. Its contract with the private supplier is worth $16 million alone, and not a lot of people who are approved to use medicinal marijuana are actually buying it through the government. They also say because so many people are using this program, it takes a lot of time and hours for Health Canada officials to go through all the paperwork. So with these changes, they're streamlining it and hoping to save some money. But also for the patients, from their perspective, the government says this is going to be better for them because it's going to give them more access to the medicinal marijuana, give them more choices, more options. But that's where the price increase is going to come in. Right now, if they buy it through Health Canada, it's about $5 a gram, and that's actually subsidized. So that's a cost to taxpayers, the government says. Once this is on the open market, it's going to be up to companies to set the price, so it could jump up to $7, $8 per gram. But so that's what patients will be looking at. But overall, the government says they needed to do this overhaul to improve the program.
Interesting stuff. Megan, thanks so much for this.
My pleasure.
That's our Megan Fitzpatrick in Ottawa.